Hello, I'm Natalie Kunsman, MD, and today I'm going to demystify SIBO. So what is SIBO? Well, it stands for Small Intestinal Bacterial Overgrowth. And it is quite a common condition, but we need to define exactly what it means. So as the initials describe, it is intestinal bacteria in the small bowel where it really doesn't belong. So to explain this, the stomach and the small intestinal tract barely have any bacteria by nature of the acid environment that's there. So in the small bowel, it may have some lactobacillus and some streptococci, but the primary bulk of our digestive bacteria is housed in the large bowel, or what we call the colon. So the symptoms of SIBO are quite common and need to be honed in to figure out exactly what's going on. So you may have diarrhea or constipation or an intermittent battle between the two. You may have gas and belching and bloating and intestinal discomfort, especially in the early part of the digestive process. And there may be some trickle-down effects which are a little bit complicated, and again for another lecture, but may have some trickle-down effects such as skin disorders, inflammatory conditions, hypothyroidism, diabetes. So we will get into that later. So with those symptoms, you may present to your physician, and I see this quite commonly. So I am an integrative physician, and I will say that the workup for SIBO usually will begin with working at some of the bigger facets of our diagnostic tools, such as blood work, presumably an upper scope, and maybe even a colonoscopy, and that's to rule out some of the bigger pathologies such as ulcer disease, gallbladder disease, polyps, Crohn's, diverticulitis, and the like. Now, the causative factors of small intestinal bacterial overgrowth may come from simple things such as stress, which is ubiquitous in a lot of our lives, motility disorders that will render the motor complex of the peristalsis and the speed in which and the transit of the digestive process, that may be rendered slowed down. We may also have some bacterial antibiotics that have been used that may alter the bacterial ratios. We may also have some ileocecal valve dysfunction, and the ileocecal valve is there to get the food to pass from the small bowel into the large bowel, and if that remains open or dysfunctional, some of it can be backlogging into the area of the small bowel where it does not belong. Now, you may also have an immunity issue such that that will throw off some of the bacterial ratios, and you may have a diet currently that is promoting bacteria in the wrong distributions or wrong areas. And you may have had some underlying Crohn's disease, inflammatory disease, celiac disease, which will affect the local immunity and the local motility to the gut. And then if there has been some surgeries where some portions of bowel has been removed, we obviously have changed the ball game when it comes to digesting our food. So how do we go about diagnosing SIBO? Well, the gold standard, which would be ideal, which would be putting you under anesthesia so that we could actually thread a guide that could aspirate in the small bowel, in the beginning part of the small bowel and the lower part of the small bowel, and take that aspirate and culture it on a culture media to see what is growing out. Well, that is nearly impossible to do as the gold standard because it is quite complicated. So what we have at our disposal, which will infer a lot, is actually a breath test analysis. And what that does is it gives us a baseline reading in which we will blow into a tube and a vacutainer and measure the pH at that particular time. Then over a series of minutes, we will take in some lactulose, which is something the body doesn't digest very well, but some of the bacteria that will take that lactulose in will secrete or expire out hydrogen or methane gas. So at 20, 40, 60, 80-minute intervals, you will continue to take breath analyses and put them in vacutainers, and that will imply lower and lower and lower into the small bowel to see if there are any bacteria taking up the lactulose and expiring them. And there will be a final half hour after the 80-minute mark and yet another half hour after the 80-minute mark to give a complete assessment to see if there are bacteria secreting the hydrogen and methane products. So this will give your physician or practitioner an idea of whether or not there is some intestinal overgrowth in the small bowel. So to treat this, there are many ways to go about it. So of course, there are antibiotics that can actually go after those bacteria, and there are a couple true prescriptions, but a lot of those people will relapse if you don't correct some of the underlying problem. And a lot of the underlying problem may be the dysbiosis. Now, probiotics can get very complicated in this arena because with probiotics comes prebiotics, and the prebiotics may actually feed some of the overgrowth. Now, diet will play a big role in correcting this because there are a lot of high carbohydrate, high grained foods that will break down and actually feed those bacteria, and we want to eliminate that. So a lot of that is the FODMAP diet, which is the fermented oligo and monosaccharides that we would like to avoid so that we can almost get those bacteria to die off by themselves if they're not being fed. Now, another approach would be correcting the underlying issues. So if you have celiac disease, you must go gluten-free. If you have a motility disorder, there are medications, for instance, that can help with the motility. There are actually approaches with intermittent fasting, which will do a few things. Intermittent fasting will help to quiet those bacteria down, but it also helps with the motor complex and helps with the motility motility issues with the bowel. Now, to that note, being sedentary is quite harmful to the peristalsis of our gut system. So we need to move to help with our digestive processes. Again, if there are some bowel surgeries that have taken place, this will complicate the picture, and you really need to access a physician to help you do this. Now, there are some herbal and supplemental approaches that can help with some of that bacterial overgrowth and killing them off, such as berberine and oregano and some other candicid products. There are some nutraceutical products that can also help with this. And I can't emphasize enough that this can be as simple and as complicated that if you choose some of the wrong items to try to repair your gut, it may backfire on you. So this is just scratching the surface with SIBO. It is a real entity. It is a little bit tricky to diagnose. It is a little bit tricky to take care of all of the facets that can contribute to it. I would entertain any questions below. We will do a deeper dive on gut health and gut bacteria in future video casts, but I would love to hear of your experience and of your knowledge and how we would like to proceed further with discussions on SIBO. So again, I'm Natalie Kunsman, MD. If you have any gut-related issues that are not making sense and your physicians are saying they cannot find the etiology despite scoping, there are deeper dives. There are ways to investigate your gut health. SIBO is one. There are many others that we can talk about in the future. Subscribe to my channel below. And until we meet again, be well.